My name is Mackenzie Meldrim. My student ID is 3254433, and this is for my Clinical Pathology 2 class, section 33430. So in this video, I'm going to demonstrate how a modified Knott's test is performed. The purpose of this test is to concentrate microfilaria and to differentiate between acanthochylonema, and dirofilaria, which is heartworm. So these two parasites, on first glance, they look very similar, but using this test, we can appreciate that they have different body lengths, different body widths, and different shaped heads. So we're going to go ahead and get started. So first we have our 1 ml of anticoagulated blood, and I got it from my EDTA tube. And then I have my 9 mLs of 2% formalin. So I'm going to go ahead and mix those two together. And I'm going to make sure that they're thoroughly mixed by gently inverting the tube and making sure it's one cohesive mixture. And then I'm going to put it into my centrifuge, and it's going to spin for 5 minutes at 1500 RPM. And when we're finished, when it's finished spinning, we'll go on and move on to the next step. So now that it's been 5 minutes and our mixture has been in the centrifuge spinning, you can see that there's the supernatant. And then it's a little hard to see, but right down here is the sediment pellet. And what we're going to do now is we're going to pour out the supernatant, and we're going to do so in a way that we're not going to disrupt the sediment at the bottom. So I'm going to go ahead and do that. So I still have it down at the bottom there. And I did get some clotting, so what I'm going to do is I'm going to take my applicator stick, and I'm going to be very careful not to disrupt this down here. I'm just going to disrupt the clot a little bit so I can get the rest of my supernatant out, because we don't need all that in there. And my clot is still in there. So now I'm going to take my new methylene blue dye, and I'm going to drop just 1 drop in there. Okay, and with a pipette, I'm going to mix it around, and I'm going to suck some of it up. And I have my slide right here, so I'm going to put a little bit onto the slide. And I'm going to place my cover slip right on top. Okay. Right, now I'm going to look at it underneath the microscope, see if we can find any microfilaria. I'm not seeing any microfilaria, so we'll go report this to the doctor. So I'm going to demonstrate how to perform a fecal direct smear. Direct smears are the simplest fecal procedure that is done in a veterinary lab because there's a minimal amount of materials and equipment that are being used. The materials that you need for a direct smear are a microscope slide, a cover slip, saline, which is what I put into this syringe, and a wooden applicator stick, and then of course a stool sample. A direct smear doesn't actually need a ton of feces to work with, so I'm just going to take a little bit with my applicator stick and put it directly onto the microscope slide. And then I'm going to take my saline and put that on the same spot. Alright, and then with my applicator stick, I'm going to mix them together until I make a homogeneous emulsion, and the emulsion should be clear enough that you should see it through like a newspaper. You could still read the newspaper underneath, and if it's too thick, then it won't work as well. So once I've done that, I'm going to take my cover slip and put it over the emulsion. And then I would take my microscope slide and put it under the microscope at 100 or 400 times magnification, and that's where I would look to see if there's any presence of eggs or larvae. A few disadvantages to the direct smear is that because you're using such a small amount of feces, if an animal has a low parasite burden, it might not be appreciated enough in this sample. And then you can also get a lot of fecal debris, which can be mistaken for parasitic material. So in this video, I'm going to demonstrate how to do a fecal flotation. So essentially, fecal flotations are, it's all about specific gravity, and the solution that you use in your sample, along with your stool sample, is going to be a higher specific gravity than most parasitic eggs. And what that means is the eggs will float if they are present in the stool, and that way you can look at them microscopically. So I have my stool sample, and you really only need about 2 to 5 grams of it, so I'm going to go ahead and put it in here. And then I have my sheathish solution, which is essentially sugar water. And I'm going to pour that into here, about 30 mLs usually. And then I have my fecal loop, and I'm going to mix the two together until I create a emulsion. We're mixing together. Okay, and once I've done that, I can take my container, and I'm going to lay across it a gauze square so that I can filter out the bigger particles. And this can get a little messy, as you can see, so I would recommend putting down a paper towel. And as you can see, the larger particles are staying above the gauze, and the smaller particles are passing through. And you can also use more than one gauze square, so I'm going to go rid of this. And now that I have my mixture in here, I'm going to go ahead and add more of the solution until it makes sort of a dome meniscus at the top. And as you can see, there's sort of that dome there. And I'm going to take my cover slip and put it directly on. And then I'm going to let it sit there undisturbed for about 10 to 20 minutes, and then we'll come back. Okay, so it's been about 10 to 20 minutes that our sample's been sitting here, so I'm going to go ahead and take my microscope slide, and I'm going to take the cover slip directly off, and the liquid part should be on the bottom, and I'm going to go ahead and place it directly on my slide. And then I can go bring it over to the microscope and view it under 100 times magnification to see if there are any parasitic eggs present. So I'm now going to demonstrate how to do a centrifugal flotation. It's very similar to the simple fecal flotation, except that you use a centrifuge, and it's more sensitive, so that means that more parasites, or more parasitic eggs rather, are going to be found, and it's done in less time than the simple fecal flotation. So like the first, like the fecal flotation, I have my 2 to 5 gram solution, fecal sample, and then I have my solution. So I'm going to go ahead and add the same amount that I did last time. And then with my fecal loop, I'm going to make an emulsion. We'll add more. And just like the last time, I'm going to take a gauze square and filter out all the larger particles, but instead of using a container, I'm going to use my centrifuge tube, and you can notice that it has a conical end to it. So I'm going to take my gauze. And again, you can use more than one gauze square. And as you can see, we have our emulsion in here. And I'm going to do the same thing that I did last time with the fecal flotation and fill the rest of it up with my solution until I have a positive meniscus. Because I have to move it to the centrifuge, I'm not going to fill it up all the way just yet. And so I'm going to place it in my centrifuge, and I've already made another sample to balance it out. So I'm going to go ahead and make my positive meniscus. Then I'm going to place it directly on here and close my centrifuge. And I'm going to centrifuge it for about 5 minutes at about 1500 RPM. Okay, and then in 5 minutes we're going to go ahead and open it back up. Okay, so now that it's been 5 minutes, we can go ahead and open our centrifuge. And since I've made 2 samples, I'm going to take the cover slips from both of them and look at them under the microscope. So I'll take it directly from there and place it onto my microscope slide. Like the other one. Okay, and now that I have both my slides, I can go bring it over the microscope and look at it under 100 times magnification to see if I can find any parasitic eggs. So lastly, I'm going to demonstrate how to perform a fecal sedimentation. So unlike the other last 2 fecal diagnostics, the simple flotation and the centrifugal flotation, this is meant for parasitic eggs that are heavier and they don't normally float. So an example of this would be fluke eggs. And so instead of using our modified Schieffer solution, we're going to be using water when we make our emulsion. And that means that the eggs that are heavier, they're going to float to the bottom and create a sediment. So we're going to go ahead, we have our 2 to 3 gram fecal sample, and we're going to go ahead and add water to it. And then mix it around to make our emulsion. And just like before, we're going to filtrate it into this container. And again, the larger particles are going to stay above the gauze. So we'll do it a few more times. And then we're going to fill the container up with water, and we're going to let it sit for about 15 to 30 minutes. And in that time, all the everything that is heavier than the water will sink to the bottom, and then we'll do our next step from there. So fill it all the way up. All right, and we will let this sit for 15 to 30 minutes. All right, so now that we've waited 15 to 30 minutes, we can take our sample, and you can see that there's the supernatant right here, and then the sediment is all on the bottom. So now we're going to wash it, and what that means is we're going to pour out the supernatant as gently as we can so that we don't disturb the sediment at the bottom. And then we're going to refill it with water and wait another 15 to 30 minutes. So I'm going to pour my supernatant out. And I'm going to leave a little bit more in here just because I don't want to disturb the sediment. And then I'm going to fill it back up and wait another 15 to 30 minutes, and then we'll do this again. And this is generally done about 2 or 3 times. For this purpose, we're only going to do it the one time, and then we'll move on to the next step. Okay, so now that we've let our sample sit for another 15-30 minutes, you can see that the supernatant is a lot clearer now, and the sediment is still at the bottom. So we're going to go ahead and pour it off, the supernatant. So now I'm going to take my pipette and I'm going to mix it around and take up a little bit into the pipette. And I'm going to put a small amount onto my microscope slide. And I'll put like a few drops. And then I'm going to take my cover slip and put it directly on, and then I can take my slide to the microscope and look at it under 100 times magnification to see if I can see any parasitic eggs. So in this video, I'm going to demonstrate how to collect a free catch urine sample. We would use this method of urine collection if an animal comes in and doesn't have a palpable bladder that we can get through a cystocentesis. And we would also use this method, or we would have our clients use this method at home if they're getting urinalysis that way. So ideally what you would need is a container that's been relatively clean. It's not a sterile sample, but we still want as least amount of contamination as possible. And ideally the urine sample should be the first of the morning, because that's when the urine is most concentrated and it's less affected by diet. So we're going to go outside, and when Hazel bends down to, or squats down to urinate, we're going to go place this underneath her and catch the urine that way. And when she bends down, I'm going to wait a second while she urinates, and that's called a midstream sample. And that's to ensure that there's a least amount of contamination as possible. So ideally we would want a larger sample, but this is all Hazel was willing to give us. But we can use this for urinalysis as a starting point. All right, and then we can go inside in the lab and begin to analyze it. And as you can see, this urine sample is pretty concentrated, which is usually what we would want. It's yellow, it's not very cloudy, which would be indicative of possible infection. So in this video, I'm going to demonstrate how to perform a cystocentesis. You would perform a cystocentesis if you're trying to get a sterile urine sample and the patient has a large palpable bladder. So a few things we're going to need. We have a scoop for when our cat is in dorsal recumbency. That's where we're going to position them. We have our alcohol, our 10 ml syringe, and we have two 1-inch 22 gauge needles, and then of course our sterile collection tube. So the way you would begin a cystocentesis is you would place your patient in dorsal recumbency, and you would place the you would insert the needle into the skin dorso-caudally through the bladder wall. And with cats and female dogs, you would insert it on the ventral midline. Excuse me, on the ventral midline caudal to the umbilicus. So there are a few methods that you can do for cystocentesis. There's the blind stick. There's the palpation isolation, where you would palpate the bladder for size and location, and then you would isolate it from the rest of the internal organs. And then there's also the ultrasound guided method, where you would use an ultrasound to guide the needle into the bladder. So I'm going to go ahead and place our patient into dorsal recumbency. And the person doing the cysto is going to insert the needle using our alcohol. And it's very important that when you, after you place the needle through the skin, that you're not relocating it or re-inserting it, because that can also cause damage to the internal organs. So now that we have our urine sample, we can draw the needle out. Okay. And now I'm going to take my needle, my syringe, and I'm going to transfer it into a sterile container. And before I do that, I'm going to change my needle to a fresh one, and this ensures that there is not any contamination from when you initially inserted the needle through the skin. So I have my fresh needle. as you can see, this urine is pretty dilute, and this cat happens to have kidney disease, so it's not unsurprising that this urine is not very concentrated. So in this video, I'm going to demonstrate how to place a urinary catheter in a male dog. So our patient has been sedated and is in lateral recumbency. And one of the reasons you would perform or place a urinary catheter would be if you're trying to get a sterile sample for a culture and the bladder is either not big enough or palpable for cystocentesis. So one of the most important things to remember when you're placing a urinary catheter is that everything has to remain sterile for the entire procedure. And this is to make sure that no outside bacteria is introduced to the urethra and the bladder. So these are the materials we're going to be working with. We have our sterile gloves for the person who is actually placing the catheter. We have our sterile drape to place over the area, our sterile lube. We have our surgical scrub, which is what we're going to use to clean the penis and the prepuce area before we place the catheter. And then we have our syringes and our sterile container for the urine collection. And then, of course, we have our urinary catheter. So in this case, we're going to be using a size 10 French catheter. And depending on your patient, whether they're a dog, cat, male, female, this kind of is what factors into your decision when you're deciding what type of catheter to use, as well as whether it's going to be short-term versus long-term. So, for example, the Foley catheter is used primarily for long-term placement, and this is because it's built to remain in the urethra for an extended amount of time. Alright, so first thing I'm going to do before we even think about placing the catheter is I'm going to clean the prepuce area before we extrude the penis. And this just makes sure that the entire field is clean. Alright, next I'm going to hand the drape to the person who's placing the catheter, and then she can get ready with her other things that she needs to, when she's getting the sterile gloves on, so I will be handing her the drape. And then I'm going to extrude the penis so that the actual penis can be cleaned and prepped for the catheterization. So now that we have our sterile field, I'm going to extrude the penis, and I do this by pulling cranially on the base of the penis and caudally on the prepuce. And now that the penis is cleaned, we can take our sterile lube. I'm going to put it onto the sterile field here, and our person who's going to be placing the catheter can then lubricate the tip of the catheter and put it into the field. Right now she's going to feed it through to the catheter, into the urethra.
So I'm actually not happy with this size, so we're going to get a different one.
Should we keep going? So if you're not, yes, sometimes you're not happy with the size of your catheter, and then you have to readjust. So I'm going to get a smaller size catheter. So this is a smaller catheter that we're going to be using. In the meantime, I'm going to re-clean the penis. And actually, once the catheter is in place, the penis doesn't actually have to stay extruded. So once it is in place, I'm going to go grab the syringes. And then you're going to go ahead and gently pull urine from the catheter. And actually the first few mLs of urine you are actually going to discard, and this is because you don't want to contaminate your sample from when you initially advanced the catheter into the urethra. All right. And once you have your sample that you need, you can go ahead and transfer it into a sterile container for analysis, culture, whatever you end up doing with it. And then the catheter is then gently removed from the urethra. And that is how you place a urinary catheter in a male dog. So in this video, I'm going to demonstrate how to collect, prepare, and evaluate an ear cytology. So a lot of times when dogs and cats come in for an ear cytology, they're coming in because their owners are making complaints about them shaking their heads, scratching their ears, and sometimes they can even appreciate a foul odor or discharge coming from the ears. So when you go to do your cytology and get your ear swab, you're going to swab each ear with a different ear swab in order to make sure that you don't cross-contaminate. And you can do this either directly into the ear or through an otoscope. In this case, I'm going to do it directly, so I'm going to place my swab into the ear and get as much as I can into here. And then, so that's one ear, that's the right ear. And I'm going to roll it onto my microscope slide. That's one. Alright. You can also get the outer flap too, as much debris as you can. Put that onto this slide. Okay. Now you can see I have my two swabs, and I'm going to label it so I know which ear I'm looking at, and put the name of the patient as well. And then I'm going to take my slide over to the microscope and evaluate it from there. So now that I have my slide, I'm going to, before I go to the microscope, I'm going to stain it and dry it. So first I'm going to dry it using this lighter so that any larger pieces of debris don't fall off. And then these are our stains. We use Diff Quick, which according to the instructions, the slide should stay in the stain for about 10 to 15 minutes for each stain. So that's what I'm going to go do. And then after I use each stain, I'm going to cover it up for next use. And then after this last stain, I'm going to wash off the remaining stain with any excess stain with the sink. So I'm going to have my sample facing down, and I'll have my finger on the frosted part of the slide. And then using a little bit of water, I'm going to have it run down my finger and onto the slide. And this way I don't lose any of my sample. And then I'm going to dry it with this hair dryer until it's dry. And then then wipe off any excess moisture on the other side. Now that my slide is stained, I can put it under the microscope, and I'm going to have it under the lowest lens. Turn it on. And I'm going to use my coarse and fine adjustments to make sure that I can see it properly, and then also move it around until I get a good spot. And so right now I'm on the left ear. And so before I move to my oil field, I'm going to place some oil onto the slide, right on the spot I'm going to look at. And then now that I'm looking at it under the oil, I can move my field of vision around and see if I see any organisms. Right now all I'm seeing is debris. So now I'm going to move to the right ear, see if I see anything. Nope, just debris. So this ear slide doesn't have any infection in it, and I'll be explaining that to the doctor so that they can tell the client. Alright, so I'm going to demonstrate how to do a skin scraping. You would do a skin scraping to see if an animal has mites or any external parasites. So we have our material over here. We have our 10 scalpel blade. We have our microscope slides and then mineral oil. So what you can do is you can kind of dull the blade out because it's very sharp. You don't want to cut the animal more than you need to. And then we're going to put a little bit of mineral oil directly onto the slide, and then dip the blade into the mineral oil. And then I'm going to find my area. This is a pretty good spot. I'm going to squeeze the area, and then having the scalpel blade in between your forefinger and your thumb, you're going to take it, have it perpendicular, and then you're just going to gently scrape the area until you get a little bit of capillary bleeding. So you don't want to scrape too much because you don't want it to be deep. You don't want to cut the animal too much. So I'm just going to keep doing it until we get a little bit of blood. And then we are going to take what we have on our blade and put it into the mineral oil. And then we'll put a cover slip on it and then look into the microscope to see what we have underneath. Okay, so I have my slide and I've put a cover slip onto it. And I'm just going to write the name of our patient just so I don't confuse it. Alright, I'm going to put it on the microscope. I'm going to turn the microscope on. And I have it at the 4x, so that's, you can see the mites that way. And I just want to focus, and you want to look at a wide margin. Just look at the entire slide so you don't miss anything. And it doesn't look like there's any mites here, so we'll report that in with the client.